This week, we have covered a lot of ground about teen suicide. The startling statistics from the CDC that it's the second leading cause of death in young people aged 10 to 34. That there have been double-digit increases in Black and Hispanic communities just in the last couple of years.
We've talked about the signs, the resources, and how to talk with our kids about suicide. So today, we're answering your questions. Mel is at a group's headquarters in Neptune Beach called Here Tomorrow, where there's free counseling and help for people. And people need to know, Mel, they are not alone.
They are not alone. And I hope that's what people understand after all of our coverage this week. This is something that so many people are struggling with. And it's interesting as I'm listening to some of these calls that are coming through. A lot of the counselors here are discussing that, you know what, let's get the conversation started early. And that is the key. You don't want to get to the point where you're considering suicide. Let's talk about it now. Let's get our kids engaged now so that we can intervene before it gets to that point. I want to bring in Dr. Christine Cauffield, who's with Lutheran Services Florida, a trained psychologist. Thanks for coming in today. Let's talk a little bit about what's happening right here. So these are certified recovery peer specialists, a number of things that they have to do to be qualified. Yes. But what's happening here is it's kind of peer to peer. So it's people who are also going through things, or they had a family member who maybe died from suicide, and they're able to give that firsthand experience.
Absolutely. And at LSF Health Systems, we train. In fact, many of these callers are talking to one of our trained certified recovery peer specialists. What we're finding is people with lived experience can really engage a very quick connection and really motivate people to get into recovery, to seek the help that they need so that they don't make that choice of suicide. So I couldn't be prouder of our certified recovery peer specialists that have gone through our training.
Yeah, and we've had some people I can hear also calling, maybe they don't want the help right now, but they want to be specialists. There's a number of things that you have to do to qualify, and I know that people are wondering, well, what does that training look like?
Yes, so there's a 40-hour core curriculum that we offer, and then the certified recovery peer specialist has to have 500 hours of practicum, if you will. So we place them in the field, we place them at Here Tomorrow, we place them at other organizations, substance abuse, mental health organizations, so they can really get that hands-on experience, and then they are able to sit for the exam. So they sit for the certification exam, and then they become certified recovery peer specialists.
And they're ready. I mean, they're ready for the work that they're doing.
Yes.
Who would you say should call this morning? If they're at home and they're seeing this number flash on the screen, who should make this call?
A loved one, a person that's experiencing thoughts of suicide, a neighbor, anyone that is concerned about someone that might be considering suicide. It's so important to reach out and get the help and support that one needs. There's no need to suffer. We have this wonderful organization Here Tomorrow, one of our providers in our network of care at LSF Health Systems, and they do incredible work of helping people move forward, not make that decision, get the help and the support that they need so that they can move forward in a very healthy manner.
Dr. Cauffield, thank you so much. And, want to talk more about this organization, because here you are able to get up to a year of counseling. And then if you need more, they push you into the resources that are necessary. So we're here today. You see these phones, they are ringing, which means you all are calling. So thank you for that. The number to call, 372-9087. We will be here through the 10 a.m. newscast today, but then beyond that, they're able to handle your calls until 8 p.m. and then again from 10 to 6 on the weekends. We'll continue to bring you live coverage. We're going to talk with a young lady who is actually starting a teen recovery group, a peer group, where she's trying to get everyone talking about mental health.